legislative consultant for the Washington State PTA. And on behalf of Washington State PTA, I'd like to welcome Superintendent of Public Instruction, Chris Reykdal, Governor's Office K-12 Policy Advisor, Maddie Thompson, and Department of Health Deputy Secretary for COVID Response, Lacy Fehrenbach. So we've got a pretty heavy-hitting panel today, and we've got a lot of questions. Many of you sent in questions in advance, so we've given those to our panelists. I'll be calling them out and kind of posing those to them, but feel free to use the Q&A, as Tony said, not the chat, if you have questions, and if time allows. So I'm seeing a note that I don't see anyone on the screen. I'm not sure. Panelists, Tony, maybe you can chime in. I think panelists should be showing when they're speaking other than me. I don't know.
Yes, as you speak, Marie, we have your photo, and then we can see Lacy and Maddie and Superintendent Chris Reykdal in the video windows. If participants don't see that, they can each manage their windows to either look at the video in multiple windows or as an active speaker. But each participant can choose how they view their video. But it is functioning.
Thank you, Tony. So we'll be going through the questions that people have submitted in advance, and then we will see if we've got time to basically answer additional questions. So we're going to get it started and just say, I know that some people are saying they don't see the entire panelists, they just see my photo. You will hear, I think, then whoever is speaking next. So what I'm going to do is ask each participant, starting with Chris, talk briefly about the new guidance for reopening schools and requirements for the fall, as well as if you can touch on the summer. And again, let's start with Chris. Then maybe Maddie can talk a bit about the governor's proclamation, which is a new one, and the governor's thinking behind reopening schools. And then Lacy to really explain the 6 main components and get us kind of kicked off so everybody has a good foundational start from which to go. So I'm gonna mute and we'll say, Chris, let's start it, kick it off with you, please. Thank you.
Great. Good afternoon, everybody. I'm glad you're on the call here. Obviously, things continue to move very rapidly in the state of Washington around all things COVID and bigger. So let me open with a real recognition that we're also in a time of remarkable civil engagement. I don't call it unrest because injustice for centuries sometimes calls for folks to have to take different actions to be heard. And so I want to respect the fact that our protests are leading to a better American dialogue around race. And I'm grateful for that happening in our country right now. In that context, school is a place for equity. It needs to be a place that moves towards a more equitable world. And what we observed in our shutdown was disproportionality, as we do in lots of systems. So the guidance that you heard about last week, and as we pursue, has a framework for attempting to open our schools this fall, and an opportunity to do that within certain health conditions and parameters. I want to be very clear, that doesn't mean every single kid's coming to school this fall. The conditions that we'll talk about on the call and that you've read about mean that some space configurations won't accommodate all the students, and districts will have to create processes for perhaps bringing elementary kids back and high school students online, or blended instructional models where there's some face-to-face and some distance activities. Health conditions in your particular county or region or district may prohibit your buildings from opening in full. Some of you may open and then ultimately have cases that cause the school in particular to close down for a short or longer period of time. So when we say we're opening and reopening schools, it means that we are not going to be purely online where it is possible to come back. Districts are working really hard to make that opportunity available. But I want to be clear that it doesn't necessarily mean that 1.1 million kids come back, because there are real restrictions here and we have to follow them. I want to thank Lacy at the Department of Health. She's just been absolutely fantastic in her partnership, as has the whole department. Maddie at the governor's office. There's a partner that's been very involved, Labor and Industries, that's not on this particular call, but they have a lot of role in regulating the health and safety of our employees, and they've been a part of the work as well. Just quickly, the biggest parameters and the things we hear about are 6 feet. I've said this a lot and I'll just keep saying it. The framework for planning is 6 feet. When you sit every student down in an instructional setting or a teacher, they need to be 6 feet apart, and that's not negotiable right now. It can't be 3 feet or 4 feet, it needs to be 6. That said, the bell is gonna ring and kids are gonna go to their next class, and they're gonna pass each other in the hall, and they're gonna violate 6 feet. And that is understood by us and by health and by L&I and others. Lacy will talk a little bit about the multiple frameworks. So those of you in PTA know we use a term multi-tiered systems of support and education, and it's not dissimilar. There are multiple layers of protections that we need to think about. Some are universal, everyone's doing it: hand hygiene, face covering, social distancing, cleaning protocols, screening, and cohorting as much as we can, putting students in small groups. So we're doing all of those things to create this opportunity to open schools in the way that we can, as best as we can. But if you're reading 6 feet and you say, well, there's no way they can enforce that. Well, there are times where it's not going to be, but the planning framework is 6 feet, and we need to rearrange our physical space to do that. Another one is screening, and I think Lacy will talk a bit about this, but there will be screening protocols. They point to the CDC guidance, which means there's a little bit of flexibility there as well for districts. Some districts are going to choose to do this as kids arrive, and others are going to go to an attestation process. They're going to task parents and families with either paper processes or more likely apps that are being developed to affirm before they send their kid to school every morning that they've gone through a screening process, and they'll attest to that. There's going to be a lot of differences in our schools about cleaning practices and the way we wash hands, and the limitation on some of our facilities, and people need to be prepared for that. But I am grateful for the work of our districts. Our superintendents have a nearly impossible task of trying to parallel plan for the best opening that is allowable by the health, but also understanding that it may not be available for every student. And there are some families who are going to choose not to come back. They don't want an alternative learning setting, and they don't want to unenroll from their district and go somewhere else. They want to stay with the district, but they want an experience of additional learning from home. And as I've said to you on these calls before with PTA, you know, the most important relationship, of course, is that local one, staying close to your district, because they're all going to have a slightly different approach to how they do this. We're creating the statewide framework for this opportunity. It's been described as the outside edges of the puzzle, and that's about all the state has the authority to do. And then the districts are taking, you know, the other 900 pieces in the 1,000-piece puzzle, and they're building a construct and a picture for how they can have success locally. But we hear a lot about the 6 foot, and we hear a lot about face coverings. Those are mandates. We are covering our faces, and it's very, very important. And Lacy can talk a bit more about that health side as well. We've heard arguments from both sides about how we shouldn't do that or should do that. That is the best available science as we understand it, and it's going to be an expectation. The last thing I'll say is we did have this group that came together, 120 plus people. It really was about school opening. It wasn't about sort of redrafting basic ed or financial models or any of that. Maybe that work will continue. Some of it will absolutely continue, but it's very mechanical about what are the necessary questions to answer for school opening. That fed into this group, and as part of that, we looked at 13 other countries and more than a dozen other states on what they're planning. But those countries gave us insight onto how it's actually going, some with great success, some not as much. In almost every case, though, face covering is in fact the protocol. So I know we'll get questions on that and the 6 foot and busing and all that, and we're ready to go, but I'll pause, turn it over to our next guest here, and then eventually we'll take a bunch of questions. Thank you.
Thank you, Maddie.
Yes, hello to everybody. I'm Maddie Thompson with the Governor's Office. Thanks to Superintendent Reykdal for doing such a marvellous job, being such a great partner in working with DOH, Department of Health and Labour and Industries on developing those parameters that provide a way for schools to reopen as long as they can meet certain conditions. The Governor provided a proclamation that aligns with this, that allows schools to reopen as long as they can meet certain conditions. So the thing is, we were trying to strike that right balance where, you know, we've got a lot of students and families and educators that are nervous about coming back to school. They want to know what will be, you know, how they can be helped in terms of mitigating risk. And on the other side, we've heard from tons of parents who are really really wanting school to reopen again. They feel that things are relatively normal and they should be allowed to reopen. And we obviously we want school to return to normal as soon as possible, but we want to do that in a safe way. Now, the governor was quite nervous. He released a statement that said, you know, if we do see a change in the health conditions in the air, if we see spikes in COVID, we may have to pivot back to a different plan. You know, he wants people to be aware of that. But for the time being, he's optimistic that we can move forward and that schools can make adjustments to meet these conditions. I want to thank all of you for adjusting your lives and supporting, you know, the children in your lives. I'm a parent myself. I know it's not easy. We're all just doing our best. So I'm always keen to hear from you, and you know, you can let me know through Marie or let me know directly what issues you're dealing with. And with that, I'll hand it over to Lacy.
Lacy, you're muted still.
Thanks, Maddie. I will start just as Maddie did by thanking all of you for being with us on this journey through a pandemic. It is stressful, it is uncertain, it is uncharted, and we are all learning. There's nobody who's an expert on how to get through a COVID pandemic. It is a novel virus, so I want to remind everyone of that. And just thank you for your flexibility, for loving and supporting your children through this. And want to start by saying or sharing what we know about children and COVID at this point in time. So generally around the world, in the US and here in Washington State, children make up a pretty small minority of confirmed cases of COVID-19. You know, depending on which country you look at, ranges between 1% and a few percent of total cases. In Washington State, the children under 20, so 0 to 19-year-olds, are 7% of cases. And if you look at children under 9, they're about a third of that. And then children 10 to 19 are 2/3 of that. We also are seeing a trend that when children do get COVID, they, for the most part, appear to have generally milder cases, very mild symptoms, or possibly no symptoms. There are, I'm sure as you've read in the media, some reports of this concerning multi-system inflammatory disease. We're still continuing to learn more about that. We just want to remind people it's a very small number of children who are getting this. In terms of severe COVID, children in Washington State are 1% of our total hospitalizations. That's a trend that we see elsewhere in the US and globally. And so far, we have fortunately not had any deaths among children. So, you know, this is very different than a lot of infectious diseases that we're used to, where typically it's the youngest and the oldest that are the most vulnerable. In terms of children's role in transmission, we're still learning a lot here. Low case numbers suggest possibly a more limited role than we typically see with things like flu. The other pieces of information we have, there are some studies on clusters, and these are primarily in households because, like us, most of the world has been staying at home the past several months. So these are family clusters. They do the epidemiologic work to determine who was the index or first case in the family. And generally, across a few studies, children are only the index case 7 to 9% of the time. I would be very cautious about sharing those numbers or reading too much into those numbers. These are preprint publications at this point. So I think it would just be fair to say that the majority of the time, adults are bringing it into the household. And then the other piece that we are learning, which is just broadly, not specific to children, there is a challenge in this particular disease of containing it, because people often are able to spread the disease when they're pre-symptomatic. So they don't have symptoms yet, but they ultimately do in the course of their disease get them. And then there are children and adults who are asymptomatic. And that is really what is driving the recommendation around a lot of, specifically around wearing cloth face coverings, because this is a respiratory virus that spreads by droplets, but also many of our community mitigation measures. So, I'm a parent too, I will say. I am very vested in getting our children back in school in the fall. I have been on the work from home, take care of your children while you're working from home, help them participate in distance learning journey with you. So empathetic to how hard that is, the household stress that it creates, and also want to acknowledge that schools are generally very safe, welcoming, supportive environments for children, and provide many health benefits to children, and then health, social, emotional, and learning benefits, not just to those children, but to their families as well. So we really tried to come up with a framework in our guidance that layers on as many mitigation strategies as is feasible, so that we can get our kids back in school this fall. Chris mentioned there are 6, and these are standard community mitigation measures for any sort of respiratory virus. And unfortunately, they're pretty blunt measures, but they're the best we have absent a vaccine or an effective therapeutic for this virus. So the first and probably the most important is to stay home when you're sick, or if you're a close contact for COVID-19. And this is where the daily symptom and temperature check come in. It's asking us all to take a pause and really, be cautious about exposing others if we are sick or potentially sick. And certainly, if we do get sick, we want schools and communities to support people in staying home. The second is increased hand hygiene. This has been like the first message that Department of Health came out with when COVID emerged. So very frequent hand washing, preferably with soap. Hand gel is okay as a substitute, but really, really frequent hand washing for everyone. The third is the 6 feet of physical distancing. And I am sorry this is right after lunch, but this is really about how far droplets go when you cough or sneeze or shout. And there was recently a study in Lancet about COVID specifically and physical distancing, and you really need 3 to 6 feet minimum. And the more feet you have, the more protection you have in terms of transmissibility. The fourth is wearing face coverings. We've talked a little bit about that. So a face covering is a source control measure. So we're wearing it to protect others from us. When I'm wearing my mask, it is protecting the people around me more than it is protecting me. And the goal here is if I am one of those people who is asymptomatic or pre-symptomatic, I'm not sharing my germs with the people around me. The fifth is increased cleaning of facilities with special attention to hard surfaces. And this is really, to catch any droplets that might have been spread and avoid people from picking them up on their hands. And then the last one is grouping of students. And so most of the measures I've talked about have been on reducing the transmission of the virus from one person to another. This one is really about limiting the number of close contacts you have so that you are less likely to get it and you expose fewer people if you have it. So those are the 6 measures and the science around them. The other thing I will say is that, it has felt like a very long time that we have been affected by this pandemic, but we're fairly early in it. This disease has only been known for 6 months at this point in time, and the science will certainly emerge, continue emerging over the summer, and so DOH will certainly be monitoring that closely and may need to update our guidance based on emerging science or the course of the disease in our state. So thank you.
Thank you, Lacy and Maddie and Chris. Okay, we're going to go to questions so we can get this moving. And I think we'll start with one that for Chris that goes back to our previous webinar that we had a month ago, which was really talking about what happens with the first one that Lacy talked about, which is stay home when you're sick. So, you know, because of the state's attendance policy and the way that apportionment is driven out on enrollment, you know, can you talk a little bit about what you think parents need to know about the stay home when you're sick piece and how that affects attendance?
Yeah, first and foremost, this is a public health crisis. So if you're sick, stay home. I'm not going to confuse that message with anything I'm about ready to say. So then there are mechanics to that. On the money front, our attendance in our apportionment, the money school districts get from the state is not a function of average daily attendance. That's not how it's calculated. It's a function of whether the student engaged in learning on the count day in the prior month. And so districts know how to do that, and online counts for that, and face-to-face counts for that, and all of that. So I don't think there's going to be an issue with apportionment. We really want to guarantee, to the extent that we can, that districts are going to get full apportionment for the students that they serve, even as students are out with absences. The legislature might think differently of that. That would be their call to come back and change those rules. But right now, we have the ability to pay everyone, even for those absences. Now, specifically to learning when kids are out, we have already existing policies that really have been beefed up in the last couple of years to try to ensure that students get continuous learning, even in an absence system, because of sickness, because of hopefully fewer and fewer suspensions or expulsions under our new discipline rules. But there is an obligation for the school district to make learning a continuous opportunity for kids who are out. But you should expect that if there is a individual who is confirmed to be a case or believed to be a case, that local health gets involved in this. That student will be likely removed and certainly tested. And then local health really takes over from there in terms of contact tracing and all that work. The school district will not be in that business of contact tracing and doing that science. There are other people being trained for that. But the money should flow, and average daily attendance isn't a big worry. We want students to stay home when they're sick or suspected. And then we need anyone to really work closely with their building level folks, teachers and principals, to make sure that you're getting the work and the assignments and the connection with teachers if you find that you have a student who's out for any extended period of time at all next year.
Thanks, Chris. How about a follow-up here? So for families who are feeling uncomfortable about sending their children back to school prior to a vaccine being developed, will a more rigorous and supportive distance learning model be maintained and supported? And what steps will be taken to get our elementary kids at least safely back to school in the fall?
Yeah, there's actually a lot of questions in there. We'll take them one at a time here. The group who met and made recommendation to us, one of the things they did spend some real time on is what they ended up calling continuous learning 2.0. A recognition that some students may still have to be at a distance. Some families may choose to be in distance learning and don't feel comfortable sending their children back to school. Our guidance to the field, to the districts, is number one, they need to plan for that reality. So everyone needs the ability to switch to a online model, and they need to plan on it from day one in the event that they can't open their schools or lots of families choose to be at a distance. Number two, that extensive parent communication about that is essential. So it's not enough to sort of wonder. They should be surveying right now, and they are in districts, about that sort of sense of worry from families so that they can build those models. Number three, we're trying to get dollars released from the Office of Financial Management that would allow us to do professional development so that we have fewer learning management systems. What many families experienced was 5 different teachers in, say, middle or high school with 5 different connection tools for families. And we want to get that down to 1 per district, ideally. It might be 1 in elementary, 1 middle, 1 in high, but we want to do professional development on a narrower set of learning management, student learning management systems. And then the last thing is we have guided districts to have a more formal schedule about their distance learning. So be clear about what the expectation is for screen time in front of teachers. Will it be 3 hours a day and then 3 hours of independent learning? Teachers in that model will really have to flip their instruction. So normally in a classroom, it might be instruction and then students are engaged in independent work or then group work and then a teacher engages again. That really has to change, and we've asked districts to be more formal about that. It might be a lot of information from a teacher on a shorter window online and then a lot more independent work from students. The last thing I'll say about this is Districts will decide their schedules based on what they can accommodate and do based on local community planning, all in the context of health and safety. Most that I am hearing from are saying if they can't accommodate everyone, their preference is to bring elementary school kids in as much as possible, even using middle schools and sometimes high schools to get the square footage they need for the smaller classes, and then putting more of the online learning responsibility on older students, particularly high school students. That's just an example. Everyone needs to check into their own district, but there's a lot of innovation going on out there right now to try to accommodate students in a way that's safe and healthy. And if they can't, they're working on these online models to be more efficient, more effective, more streamlined with better communication.
Thank you, Chris. The next question's for Lacy. Lacy, after seeing what is happening in South Korea, so reopening schools resulting in spikes in cases and ultimately a reclosure of their schools, it seems that reopening our schools is a very high-risk proposed solution. Could you speak at all to this?
Sure. So we're all in this together with the rest of the world. There have been some spikes observed in South Korea. There also have been some countries that have opened school without much increase in cases overall or among young people. So we will keep watching and learning. I will say we have layered on many levels of protection here, as you've heard, and are taking a pretty conservative approach, and certainly a conservative approach compared to other states in the United States when you look at what other, their plans. So really, the goal here was to make the school as low risk for transmission of COVID as possible. There is no such thing as no risk. I want to be very transparent about that, but to make it as low risk as possible. And then, you know, as Chris mentioned, schools will be reporting, well, actually the results get reported directly to public health when any person tests positive for COVID. And we would do case finding and case contact tracing. And, you know, if we face spikes, that would be a reason to cause us to change recommendations. But we will be monitoring very closely, and I think we have a great opportunity with far fewer people involved in summer learning to see how summer learning goes, and use that also to inform how we get ready for fall.
Thank you. I'm going to keep you on the hot seat just a minute because you actually mentioned it. So one of our questions is about contact tracing and quarantine processes to follow with each positive COVID test that might arise in a school. Can you talk a little bit about what you think that process looks like in a school setting? And Chris might have to chime in as well here, but what's the role? What happens if someone comes down with it in a school?
Sure. Anytime a person has COVID, their result gets reported to their local health jurisdiction, and the person with COVID will be interviewed, and the case investigator will basically ask them about how they spent the last few days. And really what we're looking for when we do case contact tracing are people who were within 6 feet for 15 minutes or more, or otherwise had close contact with this individual. And then the local health department would then reach out to those people or businesses or the school and identify people who are close contacts so that those individuals could go into quarantine. Quarantine is typically 14 days. During this time, you're staying at home. You're staying at home just as though you were sick, not going out, not going with your parents to the grocery store or to pick up your favorite food at a drive-through. You're truly staying home as if you're sick and monitoring your symptoms. And then if you do develop symptoms, you would be tested, and the process repeats itself with your close contacts. If you're positive, I should be clear, yeah.
So do you see though a scenario where the entire school has to be closed down?
So we have been discussing with OSPI and school districts as well as local health For a single case, you would typically not need to shut down a school. Depending on what that student or faculty or staff member's day looked like, you might have a whole class that is in quarantine potentially, but that would be to be determined by local public health and the school. When we think about closing schools due to COVID, it would be more likely because there's either several cases identified as linked with the school, meaning the transmission happened at school, or the community transmission is so high that we're sort of going back to staying at home, if you will.
Thank you. Maybe question for Chris. There's a lot of, I think there's a lot of interest in what's going to happen with choirs and bands and music programs. So what is the thinking right now about school activities that have to do with our arts, as well as what could you share about sports activities for fall?
Oh, just those three easy things, huh? Okay, well, Lacy's not going to hide under her desk here. She's going to face the music with me on this one. So as you've been hearing, this is, obviously the significant risk here is droplets, right? And so contact is this risk for us in this lifetime that we have now. Thus the spacing, the face coverings, etc. So what has been clear so far is that choir, due to the nature of the fact that you are opening your mouth, you're verbalizing, you're using a lot of air, there is definitely more risk in this. And so right now there isn't a prohibition for choir or band, but I know there's some nervousness from public health, and so I'll finish the sports side of this and then turn over to Lacy. But at this point, what we remind everybody is this is not a nice to have. Music and choir, theater, these are essential parts of learning and basic education, and we want the opportunity to be there. But folks need to take extra caution here with choir, and it's possible. What I keep saying, and maybe Lacy will clean me up, is there may be additional guidance here for this. It is not likely going to be the safe environment to even have 6 feet. Certainly, if you're not wearing face coverings, that's not safe at all. So we'll come back to that quickly with Lacy's thoughts on it. Sports. DOH is also working on that right now. WIAA has been very involved in that. Very good progress being made. There's some limited guidance out there right now that I believe came from the governor's office on youth recreation, and we're sort of following that right now in the initial phases of spring and summer. But we do expect to get more guidance on fall sports. Again, I don't think people should, don't land on any assumptions or emotions right now. Cross country is a very different experience than putting 100 football players on a sideline together. The sharing of water bottles is a thing of the past. Perhaps 11 people in a huddle is not appropriate at this time. And so I don't know how that guidance will come out, but I've been trying to get people to be super cautious and understand that we want the lifestyle we've always had. That is not the planet we live on right now. We have a very deadly virus that's taken the lives of 117,000 Americans, projected to be over 200,000 based on the latest UW studies by this fall. We got to do things differently. And I think sports could be one that's impacted. Certainly packing 5,000 people into a football stadium shoulder to shoulder on a Friday night is not going to be the case. So not quite ready yet on sports guidance, and mostly Department of Health's work here with WIAA, but we're trying to make it consistent with our work in teaching and learning. And then a little more to come probably on music, choir and band specifically. It's not a no right now, but we got to keep thinking through where that is safe and if that can be done safely. Lacy, you may have more.
Just a few things more. I think that was very well said. I want to say we recognize music, sports, art. These are things that bring a lot of joy and meaning to our lives, and we view them as very important as well. Choir, this is one specific thing where there is a pretty decent amount of science that it is a very high risk activity for transmission of COVID. And some of you may be familiar with a cluster here in Washington State of a choir, I think in Skagit County, where one person came to choir practice and infected 52 people. So the risk is real. I think we have to figure out really novel ways of doing these things. We did, I think, allow flexibility in the guidance that choir and band could be done outside or in much larger spaces, but you're going to have to think really big spaces. We don't have good science on how far, so just like my initial thing would be to say 10 to 12 feet, as just like for planning purposes, nothing in writing or firm between people. And outside is always better than inside. If you're inside, get the ventilation as high as you can.
Thank you. So kind of a follow-up question, not necessarily about activities, but one of our questions is, the new guidance says to do physical distancing as much as possible. Does that mean physical distancing isn't required?
Yeah, so I'll start here. Physical distancing is required, and I'm using words that may not be clear enough. Our planning framework is for 6 feet. So we've had districts say, can I build a classroom where I've got kids 4 feet apart? Is that close enough? And the answer is no, you need to plan for 6 feet. So we're rearranging classrooms, taking out couches, doing what we can. That's the planning framework. The reason that the guidance does not say you're in violation if anybody comes in contact within 6 feet is it's just not practical. You need to plan to be at 6 feet all the time. There are times people are going to be closer contact. One of the mitigating strategies is that we're wearing face coverings and we're cleaning and we've got hand hygiene and all of that stuff. So again, these all layer together. The 6 feet is not negotiable right now. That is what we're doing and that is what we're planning for. But we recognize, you know, that when someone walks into the classroom with a note from the central office or the principal's office, they're going to hand that note to somebody. And that's okay. Or they're going to set it in a basket and be 4.5 feet from another student. These things are going to happen. So we don't want this culture of punitive to be what we live in, but all of the framework and all of the expectation needs to be around 6 feet, and all the planning around that needs to include 6 feet. PE will look differently. You can do a lot of physical education 6 feet apart, and no one should plan for exercises that bring them closer together. If it happens by accident, if it happens by circumstance or a particular task for a very short duration, that's different. But no one should be planning, whether it's teaching, learning, or recreation, for contact that is exposing us to distances of shorter than 6 feet as a routine.
Thank you, Chris. Okay, another question here from one of our parents. I think many parents are using the phrase, "we want our school to reopen," as actually meaning learning from home is not working. Too many teachers are not able to effectively engage and teach students via an online platform. So the real question is, if all students are not back in school, what is the plan to fix the lack of engagement and some of our connectivity? And I think Maddie had some pieces she wanted to share here as well. But also Chris.
Well, I can start on some of the connectivity issues. We have a state broadband office, and some legislation was passed year before last that's got a plan in place, but it's for 2028, and that's a bit far out there. So we've got different connectivity issues. One's related to, do schools and do families actually live in an area where there's internet access? Another is, if you have internet access, is it sufficient? Is the quality and the speed of the internet sufficient for all the people that have to be on the internet at home? Another one is, do you actually have devices, or do you have access to Wi-Fi hotspots? Sometimes the Wi-Fi hotspots are good intermediary steps. Wouldn't say it's high quality, but it's something that can mitigate for not having any internet access at all, where you can download classes, get feedback, and then do it from home. I'll let Chris address the other teaching and learning aspects of distance learning, but we have set up another 100 Wi-Fi hotspots around the state. I know school districts have also looked into it themselves, set up more Wi-Fi hotspots. We have access to information on where you can locate those Wi-Fi hotspots, and we're looking into how can we get better deals for families that are affordable, and how can we help families pay for them too. So this hasn't all been sorted out yet, but there's a lot of work, and it pertains to not just education, but people seeking work. You know, there are all different sort of aspects of our society that rely on good internet access, particularly under this COVID emergency.
Yeah, I'll just build on it. Connectivity was a big priority this spring. Hard to pull off. There are a lot of estimates on who doesn't have connectivity, but I think it's safe to say 15 to 20% of families ended up without a reliable connection, either by device or not having speeds, or having something that wasn't very effective. Districts tried to close that with devices, as Maddie said, buying Wi-Fi. We have been trying to unlock some federal dollars to purchase a year's worth of internet connectivity for families, broadband connectivity with good speeds and good ability. But to the substance of the question on the front end, you know, these connection options, we're going to keep building over time. But our goal, of course, is as much as possible to safely return as many students as we can to school within the parameters. So I know districts are making prioritization about that. Again, there are some students more able to have success in distance learning, and it's not kindergartners. Sticking a kindergartner in front of a screen for 6 hours a day is not an effective learning model. So lots of districts will say, we're going to prioritize younger students and put our online expectations for students at home. But they will continue to work on the idea, though, that for some high school or middle school students, that's not successful either due to connectivity. So they might be a priority to bring back. Students with disabilities who need therapies or really, you know, sort of high touch relationships, they are likely to be a priority to get back in our schools. People want answers right now, and what we have is a framework, and now it is time for districts to really deploy the best solutions in their community. And so we want to keep sharing with everyone the framework, kind of the outside edges of the puzzle, that at least people know the size of the puzzle and what's possible. But the districts really are now in a planning model, and everyone in PTA and all parents and students really need to engage and tune into their local district to say, okay, we understand you've got some parameters now. How are you building models, and who are you prioritizing for our highest and most effective services, and who might have resources on their own to learn at a distance if we find ourselves in that situation.
Chris, that's a great segue into a question that said, if each district is allowed to make their own guidelines, how is this equitable throughout the state? You may end up with students in part of the state with way more in-face instructional hours than other students in different parts of the state. How do you balance that?
Yeah, this is really hard, right? I mean, you all been party to trying to create an equitable system, but that's primarily defined through money. And the legislature has created a far more equitable financial system than we had even 5 years ago. So they've made progress on the possibility of equity by the way we now have pulled lots of stuff that used to be funded with levies into the basic ed model funded by the state. But deployment is a very different scenario. If you're in a community that has the capacity to have student faculty ratios of 15 kids, and you have the ability to do that versus another district down the road who doesn't have the space, and they're in learning environments of 25 students, for example, that isn't the state not funding each kid equally or equitably. In fact, we're a little progressive in the state. We tend to send a little more money to lower income communities, actually by a pretty good bit. It's that local communities have different dynamics, and local boards are locally elected. And that's the good and the frustration of our republic, right? We elect local boards, and they really matter. They make decisions that reflect the community, but it can also result in some different outcomes for students. And I don't have a short-term solution for that, because I don't think the answer is centralizing all that decision-making out of Olympia. I can give you lots of examples in industry where we don't get better customer service when they ripped out local branch managers and had corporate offices in New Jersey telling us exactly how we all have to behave. I don't think that's good. So equity is a journey. It is not something that is sitting on paper right now that the state can solve. It is really one community at a time, pushing through, and there's still going to be inequities of this for sure. I think what we did this spring was perhaps as inequitable as anything. Given the crisis we were in, we all had to shut down, and that's the truth of it. But we've made a little progress. The best thing we can do for students is to get as many of them back safely as possible. We've built systems of support in our schools, and we need to try to get back to that as much as possible.
Thank you, Chris. Next question for Lacy, and this is really quite a few comments and questions about face masks and face coverings. And one of the questions says, could you share studies and evidence? And I'm thinking, you've got my email, so maybe if you could share, some hyperlinks to things, but could you just talk a little bit about the science of the face mask and how that plays a role?
Sure. So again, this is source control, so it's protecting from the spread of droplets. There are a few studies that have come out. They have typically looked at high incidence areas that implemented a number of mitigation strategies. And one recent one looked at incidents in a town in Italy, in New York, and one other place in Asia. And there was reduced community transmission in jurisdictions that implemented a masking directive. So that is an example. I'll be happy to send some hyperlinks to Marie. Again, this is layering on interventions, and I know wearing masks is tough. I have one, I have to wear it at work. I have my door closed so that I can have it off at the moment to talk to you, but we are gonna have to get used to this. I think, a tension that we're really feeling here, and in, DOH is feeling this across every industry as it reopens. People think that when we're reopening, we're going back to what that industry, in this case schools, looked like a year ago from today. And that's really not where we are right now, absent a vaccine or effective therapeutic, and with COVID spreading at the community level across our state. We're going back to a very different normal, and we're all making trade-offs in that. And the trade-off that we're asking all sectors of society to make is wearing a mask and keeping 6 feet of physical distance as much as possible. And paying very close attention to those hygiene behaviors, washing your hands as frequently as you can. And we can, as parents, start getting our children used to doing these things. I have mine wearing masks when they're at home, just to get used to wearing them for longer periods of time than when we're out on our walk around the neighborhood.
So I just want to jump in here a little bit too and just say that we will partner with Lacy and Department of Health a little bit more on the research. We both agencies get hit with a lot of stuff that is interesting stories, but isn't always research, and that's out there flying around. And there's petition groups, who believe this violates their civil liberties, and so we do want to help those communities. We want to be responsive to that. But you're reading stuff about masks create bacteria inside of them and don't allow airflow, and that's dangerous for kids. And we'll do our best to try to put the science behind this. I would remind you that the recommendation is cloth face coverings, and the entire purpose of that obviously is avoid droplets and safety, but you can wash them. So, no, being a little facetious here, but no one says to us, how dare you have my kids wear socks? They'll get, toe rot eventually. Well, you'll wash them all the time. Like, this is a new normal, and to open schools effectively, we got to do this. So families are going to need lots of cloth face masks, and you're going to have a routine cleaning cycle to this. And we're trying to avoid droplets out. Don't think of it as the industrial concept where what you're trying to do is protect from inhalation. In those industries, they don't want any air gaps because they don't want any chemicals in. This is really about a face covering to avoid droplets and sneeze, cough, speech, etc. So it isn't like every little area has to be closed off, and air will flow to students, and they will breathe just fine, and we will clean these things. But there's an enormous amount of hysteria out there that I observe is driven very much in some parts by ideology, because we are a country that doesn't like to be told by government what to do. But most people do the right thing by their kids and send them with shoes and all that. And I don't mean to make light of that. But my observation in reading the research and the stories from internationally is kids aren't having the issue. They get asked to do something to be compliant and to do the right thing. They do it. We have an adult philosophical problem that's happening now, and that might not get solved, but I would encourage all of you in PTA to just accept Lacy's challenge here, that this is a new normal, and our chance to return to school and effective learning means that we got to behave differently, and it starts now. Wash your hands, wear a mask all summer, especially in public, but even at home, kind of get used to it a little bit, and help your neighbors who are frustrated by this to understand that in the absence of this, our cases are going to spike, and the alternative really for any governor is to shut down again, and we will all be back home again. And that was not the model that we designed, and we do not prefer that.
Thank you, Chris, and thank you, Lacy. Andrew Estep, just the executive director at Washington State PTA, said the PTA store has face masks. So I'm sure they have a cool little logo somewhere on them. So just a quick kind of follow up on that. So schools, we know that some schools, you know, vastly underfunded with school nurses. And so a couple of questions about, you know, who's going to front the costs of all of these PPEs and new hand washing stations, and the fact that they aren't out in portable buildings and things like that, as well as how will schools actually do the temperature checks and the tracking of cases in classrooms? It seems a bit overwhelming when you look at all of the things that will be required.
There is a lot here, and I want to be sensitive to that. There is a lot here. Most of our portables do have water, so hand washing is possible. Very few of them have bathrooms, however. Districts are pretty used to in and out egress for lunch where there's a hand washing routine, and so they're going to have to figure a lot of that out. There are some portable hand washing stations. We are hoping to get all of our federal CARES Act dollars unlocked, because this is exactly what districts want to do. They want to start spending the money for this PPE and getting ready for this. The educators will have their PPE paid for. That is a condition of employment, and that's longstanding state law and in the industry. So that will be paid for by the employer. Families, however, on the face coverings will likely want to do their own thing there. The districts will have some on hand, though, for students who show up and don't have face coverings. But yeah, there's definitely added cost to this, and we're trying to implore our policymakers and OFM, the Office of Financial Management, to release all those CARES Act dollars. Districts need to invest in this stuff now to be ready for the fall. There's certainly lots of talk about an additional act by Congress that might be sort of the last tranche of this, $700 billion to $1 trillion potentially of additional supports. Now, the more that hits the states, either we'll get direct support to do this work, or at a minimum, the state will be able to balance its budget without having impact on K-12 in any way, and that gives us an opportunity as well to redirect our resources for this. So there's definitely some added costs. I recognize that. It means some sacrifices will have to be made, but this is a new era.
Thanks, Chris. So we've got just a few minutes left, so I'm gonna pick out some that I hope are fairly quick answers. Clarification about the stay home sick directive. So the question is, if I have more than one child, but only one is sick, do they all stay home for 72 hours?
If your child is just sick and you don't know why, they would stay home 72 hours, just like normal. If your child has COVID, if your child has been tested and has COVID, your whole household should stay home through your quarantine period.
Thank you. I think this is back to this, Lacy, this might be partly you, but also with Chris. So we keep addressing choir. How about band? And then also, what do we think is going to happen with PE and recess at the elementary level?
So recess is allowed. We maybe need to make this clear in our guidance, because we've gotten a lot of questions about it. But recess is allowed, and outdoors is especially encouraged for recess. Children need to play. I would never subject any teacher to my children without some physical activity in their day. So recess is allowed. We would want the group, the class, to stay together. And you don't combine with classes. So there is a little bit of planning here that's needed, because typically schools just go out to recess and there are multiple classes all together. So, you know, you might have a limited space where you get to have recess compared to access to the whole playground, if that makes sense. And that is to reduce the number of contacts. PE, I think we heard, can happen. We just have to think about it a little differently. There's already guidance out there for individual training of sports. So I think there are plenty of things that could happen in PE. For band, similar to choir, and this is particularly wind instruments. I don't think we're too concerned about percussion or, you know, the marching aspects, but the wind instruments and particularly things with spit valves, I would say we would want, like the choir, increased physical distancing.
Thank you. I'm just going to look to you. Do you all have a few more minutes beyond the 2, or do you have hard stops at 2?
I just have a couple minutes left here.
Okay. So Chris, I think this is to you. So this is around our students with IEPs and students with disabilities. So many students with disabilities need literal hands-on work with OT, PT, speech therapy, teaching. How can we make sure that our students with disabilities get the help they need?
Yeah, I think that's part of that subtle sort of Q&A document that we're working on right now, where it needs to go a layer deeper, right? So with the multiple layers of protection, you know, keeping 6 feet generally, we're wearing our mask, we're hand washing, we're sanitizing, we're screening. We know there are reasons to bring some students back for sure as highest priorities because they really do need those therapies and those supports. And we expect that will go on. You heard Lacy say there's a variable to this that's, you know, hard to quantify, but this is a duration issue also. There's got to be some reason to this that is an educational purpose, but it's also a change of practice. So you may not be able to do 30 straight minutes of physical therapy with a student, but it might be in shorter stints and lots of hand washing, masks all the time, surface cleaning. So these are the hard things I think districts are weighing through right now. We are trying to indicate to them that this is, we want them to do this work. We want them to be super safe about it. So there are no prohibitions to that work this year, but they've got to take really extra precaution to do it well and safe.
Thank you. Lacy, back to you. Can you speak to the best type of face coverings we should get for our children? Do the masks need multiple layers of cloth? Cotton the best? Should they have a filter? What's best?
It's a great question. Really briefly, and we can give you a link to a couple of resources that you can share out as well. You do want a breathable fabric. So I can actually maybe show you mine. Mine is cotton. Mine is 3 layers. So breathable fabric, multiple layers. So there are kind of 3 common models that you see out there. One is 2 layers with the option to add in a paper filter. That one's great. This is all just one piece, 3 layers of cotton. The other really important thing, if possible, is you want it to cover from the child or your own chin up to the bridge of your nose, and to somehow fasten behind your ears. And you're gonna have to test things out with yourself and your kids for what works for you. Like, a lot of people really prefer the ear loop masks because they're easier to take on and off. For whatever reason, they don't stay on my face. So I have the type of mask that actually ties behind my head.
That's great. Thank you, Lacy. I was just scrolling here. I saw a couple of things because I know we're right up at we're right up. And it was about connectivity. So this is back to the question. I don't know, Maddie, if you have a sense of what's the percentage of kids that are not connected. And then there's this other issue of it's not just about connectivity, high school learning. If you have kids with calculus, foreign languages, AP, it's about engaging and not just the simply posting assignments, but it's that actual interface and engagement. So maybe a little bit, do you have a sense out of the broadband office what the deserts look like? And then Chris, again, maybe it's a question about teaching.
Well, we do have a map out of the broadband office on areas that are deserts, and I can get a hold of that and send it to you if interested. I think Chris already touched on, Superintendent Reykdal already touched on, you know, the need for professional development to help educators make distance learning as effective as possible. And so I'll just hand over to Chris if he's got additional comments on that particular issue.
Yeah, we know the deserts around the state. There's been overlapping maps between where the connectivity options are by the private sector, where some public sector options are coming available, and where it overlaps our free and reduced price lunch population, for example. So some of the early deployment of stuff had both education and the broadband office working together. With respect to the teaching and learning side of this, there was a big learning curve for folks, lots of professional development. ESDs right now are training teachers on sort of best practices of distance learning. So it's not about a modality. It's not about Google Classroom right now, or Canvas or some platform. It's really about how different it is to teach online versus face-to-face. That's phase one. If we can get our federal CARES Act dollars unlocked, again, our PD, our professional development through the ESDs would then go the next step to say, okay, your district's chosen to do this model in a Google Classroom. Let's teach you the tools and the tricks on how to also support families. How do we train families to better understand those tools? So it's a connectivity issue, but even when we get connectivity, it's also an effectiveness paradigm we have to have around distance learning. And all of that we want to move forward, knowing how much more of it we'll probably have to be doing here.
Thank you. Maybe oh, go ahead.
There was one more thing I wanted to say. Somebody had mentioned in the chat about your press release on equity. I think that was a very powerful statement from PTA, and I do hope that school districts, I know the superintendent made that one of his top priorities in the guidance that went out. And I think that's very important for school districts to keep top of mind as they're doing their own plans that are more detailed related to school reopening, especially in relation to inclusiveness. So, it might be easier to do things a certain way, but we would hope that, all options are considered at that local school district planning level. And that's what the governor would like to advocate for as well.
Thank you, Maddie. And I apologize that we won't get to all of the questions. I think this was a great step. I will say that OSPI is capturing these, I believe, and that we will be able to send the questions to OSPI. And as Chris mentioned, they are working on an FAQ that will have a lot more deep dive into some of the guidance. And the questions that many of you are asking are very similar to questions that I know even districts are asking. I guess just one final question, and this is really about how our district's going to catch up students that are behind. So they're actually getting that incomplete now, or they're behind with their IEPs with the actual physical building closures. So just maybe that's our final, and then thank you. Final thoughts from any of you, and just so appreciate you joining us today.
Great, I'll kick this off here. I think part of the priority, I know part of the priority for us and for the governor's office was not just to open our schools potentially for student learning in the fall, but to also get us available for access to our buildings this summer, starting now. So we do know, again, working with your local district, that many districts are engaging students with IEPs who were not well served during the closure, making priority for those students. English language learners, for sure. There was a task of districts to really identify through survey and connection with families who had the biggest disconnect and who had the biggest difference in educational justice as a result of the closure. Districts can now re-engage some of that work. Again, also these Jumpstart programs, they are planning to bring back intensive supports for more students and re-engage them to the extent they can do that within health guidelines this summer. So there's intentional work going on about that. Like anything with 295 districts, some doing more than others, but really engage your local district and say, hey, what's our plan this summer? What kind of services are you providing? And if not this summer, what's the re-engagement plan this spring or this fall? And how will student evaluation go with respect to understanding learning gaps and closing those? I will conclude with this. The constant reminder, we didn't lose ground to anyone in the world on this. We didn't get as far as we wanted to be 6 months ago. We didn't know this thing was going to be like this, and we wanted to have a school year but 1.6 billion kids around the world were out of school through that duration, and 53 million American kids were out of school. And so we all lost ground. We all lost 12 weeks of ideal, better than ideal learning, but some learning occurred and we didn't lose ground relative to other places. And I always remind people that, because there's a sense of anxiety. Those of us as parents, I've got two teenage kids in school, and sort of that, like, my goodness, we lost time. We did, and so did the planet. And now we want to get back as safely as we can, back on track. And that does mean some intensive supports for students who need it the most. Fight like hell to avoid budget cuts too, because we think our budgets are quite safe in the basic ed side, but there's still a little bit of risk out there, particularly levy equalization, that is, we don't think is protected, but we think is essential in our school districts. So thanks, everyone.
Maddie and Lacy, any final comments that you'd like to share with the group?
No, just thanks for all your work and your engagement with your schools, and for all the work you do with your own families. Thank you.
Same, thank you. We appreciate all that you do for your children and your communities, and all of the great questions today.
Okay, well, again, many thanks to our guests today for joining us. And I would expect that maybe we'll be circling back for another webinar, possibly in July, if we can see how things are going with districts. So again, thank you. Have a great afternoon. And we appreciate everyone joining us today.
Thank you.
Have a great day.
Thanks, everyone.